Hey there, everybody. Today we are looking at the injury that was associated with scapholunate instability in a wrestler. It is the A3 in Dr. Schulte's chart. But we had found an article by Anderson and Hoy who looked at a specific plane within the wrist that allows the scaphoid lunate ligaments to heal with the most possible range of motion. And that is called the dart thrower's plane. And so we're going to be referring that to throughout the rest of the video as the DTM, but it's dart thrower's motion plane. And so what it is if you were to hold a pencil or a dart and then throw it, you're going to go from radial extension to ulnar flexion. So it's that motion. And they found that in that range, the mid-range of that there is very little movement between the scaphoid and lunate, allowing the ligament to repair itself. So for our video, we found the article, and they looked at a type of splint. It's just a two-part splint. One goes through the palm here, isolates the CMC of the thumb, and then the second part covers about 2/3 of the forearm. And so we made these prior to the video, obviously, and what they do, they just have a distal attachment around the distal part here, just for stability. And then if you notice on here, we have kind of these attachment points where they, in their article, had used a piece of wire to go through here. It would be more sturdy, but for the purposes of this video, we're just going to use these Velcro strips. And eventually, when we apply it, it's going to be applied on the dorsal side, and then on the ventral side, on the palmar side. And to find the range for the patient, you would have them hold a pen or pencil while they have the splint on, and then kind of go through a range of motion in the dart thrower's plane. And it would only be pain-free motion, so you would have them go through, and if it's painful here, then that's where you would anchor that position so that they can't go beyond that, and then in the extension position as well. So essentially this is the orthosis that they used for treatment. Now we're going to take you through a protocol that they also use with their athletes or their individuals, participants, and it helps for their scapholunate to be repaired.
So the article for the protocol that we found, it starts with the first 6 weeks. They'll be in that orthosis that Matt showed earlier. It's an immobilization, but it's more of a motion restrictive type of one, I would say. So it still allows some of that motion within that pain-free dart thrower's plane. And so, again, like I said, first 0 to 6 weeks, they can just kind of keep that pain-free motion in there. And then after that, starting at about week 4, they could take off the brace for basically just showering and then therapy. And for that, again, they're just out of the brace and they're keeping in that pain-free motion again, active range of motion. And then at about week 6, we'll start doing some isometric strengthening of the extensor carpi radialis brevis and longus, and then the flexor carpi ulnaris, and the abductor pollicis longus, sorry. And then that strengthening is again just going to be within that dart thrower's plane. Sorry, I don't need that. So if I'm the therapist, Maddie's the patient, I'm going to do, we'll start with, like, she's going to go into radial extension in that motion. So I'd ask Maddie to move up into that motion for me. Good. And then I'm going to push down against you. Hold it there. All right. Keep holding. Good, good, good. And relax. And we go through that, 3 times, holding for 5 to 10 seconds each time. And then with the same, we're just kind of off the side, we'd go into flexion and then that ulnar deviation. So again, I'd ask her to go into position, and then I'll have you hold that there, Maddie. Good, good. And relax. And those would be the motions that we would work on isometrically strengthening.
Okay, so starting week 6 to 12, depending on how well they're healing, we can start doing some more eccentric and concentric exercises in that dart thrower's range of motion. This is when we start phasing out the the splint as well too. So like if they have like an intensive job at work where they use their hands, you can say, okay, well maybe wear the splint at work, but then once you get home, maybe try doing some stuff without the splint, and then just slowly trying to phase it out of that dependence. So some examples of eccentric concentric exercises, we'll use this TheraBand. So I'll have you hold your hand out and then kind of grip it like that. And then when we start, I'll have her go up into that radial extension while pulling it down. And then for an eccentric, I'll have her slowly lower it into that ulnar flexion, just like that. And then we can switch it up to the other way. Mix up eccentric and concentric, making sure to hit all those ranges within the plane. And then at about 8 to 12 weeks, we'll move on to more functional activities. So just like bouncing a ball, like a tennis ball. Something too really easy to do around the house is like gripping your door handles, working on that grip strength, and then just like slowly integrating all those motions back into the wrist. So like pronation, supination, flexion, extension, moving out of that dart thrower's plane a little bit. They can also do some more dynamic strengthening too. Starting to throw balls again if they play baseball or something. And it's called a slosh pipe. It's kind of like a rain stick, just working on getting all that motion back, pronation and supination.
And with the slosh pipe, that was another intervention that our study had used. It was just about, I think, 12 or 16-inch piece of pipe. They filled it up with water, and then they had them do wrist curls or wrist extension curls, but while keeping the pipe, steady or horizontal with the ground, just for stabilization. And so also specifically with our patient being a wrestler, we would want to have them work back to wrestling probably at the 8 to 10 week mark, when they start getting more like closed kinetic chain type movements, beginning with push-ups, things like that, just to make sure that they can bear the weight in their wrist, and then move into wrestling at hopefully towards the 10 to 12 week mark. So yes, if you have any questions, you can ask us in class. Otherwise, thank you for listening.